Asthma is a chronic respiratory condition that affects millions around the world, characterized by inflammation and narrowing of the airways. Common symptoms include recurrent episodes of wheezing, breathlessness, chest tightness, and coughing, especially at night or in the early morning. During an asthma attack, the swollen airways become extremely narrow, limiting airflow and making breathing difficult. Treatment typically involves the use of inhalers to deliver medication directly to the lungs, along with other medications to control inflammation and prevent symptoms in the long term. Risk factors for developing asthma include a family history of the disease, frequent respiratory infections during childhood, exposure to tobacco smoke, and environmental allergens. Here are detailed aspects of asthma, shedding light on how this common yet complex disease affects individuals and what measures can be taken for its management and control. Symptoms and progression of asthma. Asthma, a chronic respiratory disease, manifests symptoms that can range from mild to life-threatening. Asthma sufferers often experience wheezing, a whistling sound during breathing caused by the narrowing and inflammation of the airways. Shortness of breath is another hallmark symptom, as inflamed airways and mucus production make it difficult to breathe deeply. Coughing, particularly at night or early in the morning, is common, often disrupting sleep. Chest tightness or pain accompanies the sensation of being unable to draw a full breath. The progression of asthma varies. Some individuals encounter periodic exacerbations, known as asthma attacks, where symptoms rapidly worsen, necessitating immediate medical intervention such as the use of inhalers or nebulizers. Asthma can be triggered by allergens, exercise, cold air, stress, or irritants like smoke, reflecting an overactive immune response in the respiratory tract. Effective management hinges on identifying triggers, using preventative and rescue medications, and monitoring lung function to avert severe exacerbations. Diagnosis of asthma. Asthma diagnosis primarily hinges on a detailed medical history, physical examination, and lung function tests. Patients often describe recurrent episodes of wheezing, coughing, chest tightness, and shortness of breath, which are typically worse at night or early in the morning. Spirometry is the most common lung function test, used to measure the amount and speed of air a person can exhale, helping to assess the narrowing of bronchial tubes. Asthma can mimic other diseases, so pinpoint accuracy is crucial. Doctors may also use a bronchodilator to confirm the diagnosis. Significant improvement after its administration is a strong indicator of asthma. At times, additional tests like allergy testing, blood eosinophils, and exhaled nitric oxide levels may be employed to identify potential triggers and the severity of inflammation in the airways, further guiding treatment plans for effective disease management. Cause and risk factor of asthma. Asthma, a chronic inflammatory disease of the airways, arises from a complex interaction between genetic predisposition and environmental exposures. Key risk factors include a family history of asthma or allergies, which can increase genetic susceptibility, and early life exposure to allergens such as dust mites, molds, pollen, and animal dander that can trigger asthmatic responses. Air pollutants, cigarette smoke, and respiratory infections, especially during childhood, can exacerbate the condition. Occupational exposures to chemicals or dust can also trigger asthma in adults. Furthermore, obesity is recognized as a significant risk factor, potentially due to the systemic inflammation it can cause. Identifying and mitigating these risks can help manage and reduce the incidence of asthma. Treatment and management of asthma. Asthma treatment and management require a multifaceted approach to minimize symptoms, prevent exacerbations, and maintain normal lung function. Fast-acting bronchodilators, such as albuterol, provide rapid relief during an asthma attack by relaxing the muscles surrounding the airways. Long-term control often involves inhaled corticosteroids to reduce inflammation and prevent flare-ups. For individuals with moderate to severe asthma, combination inhalers that contain both a corticosteroid and a long-acting bronchodilator can be critical. In cases of allergy-induced asthma, immunotherapy may be effective. Asthma management also includes identification and avoidance of triggers, regular monitoring of lung function, and an individualized action plan to tackle emergent symptoms, ensuring that patients can lead active and unrestricted lives.